Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Aging in Place with Dignity, sponsored by Prince George's County Government and the Department of Family Services.
A great thanks to Dementia Friendly America, Prince George's County of the Northern Sector. It's an honor to be part of this program. And tonight, as Mitchell indicated, we're going to talk about aging in place with dignity. And in 2020, there's never been a topic that's more important than this topic that we're going to talk about tonight. So tonight, here's what we will cover. One moment, just a technical. What we'll cover tonight will be, what does it mean to age in place? Everyone is talking about aging in place, but it means something different to each individual. We'll talk about what things need to be considered in order for each of us to age in place with grace and dignity. And we'll also address, what are the steps? What does it take? So we'll talk about, what does it mean, what things need to be considered, and what are the steps to aging in place. And so to start this program, I'm presenting a definition from the US Center for Disease Control and Prevention. And that is, aging in place is defined as the ability to live in one's home and community safely, independently, and comfortably, regardless of age, income, or ability level. So let's look at that. The first part is living in your home safely. So we'll talk about, what does that mean? What does it mean for you to be safe and be able to live according to the way that you want to live? Living independently, being able to do things on your own terms at your own time and comfortably, meaning that you're living your optimal lifestyle, regardless of age, income, or ability level. I think that that's a great way to start. And when I found this definition, I felt I definitely wanted to add this into the program. So this is for each of us. And for each of us, keep in mind, we will have different answers to these questions. So my point tonight is to bring these thoughts, if you haven't already started to formulate these thoughts, to bring these thoughts to your mind, to help you start to formulate a plan. And each of us, like I said, may have different things in mind of how we would like to live, where, why, and so on. So let me talk about what things should be considered in order for me to have an effective plan to help me age in a healthy way. And please jot down your questions. At the end, I'll be happy to address any questions or points that you may have regarding the presentation. So you see little icons there. Maybe, maybe we're not lifting weights. Maybe we want to go on a cruise and spend our our years cruising. Maybe we want to have stacks of money, or even just small stacks of money. For each of us, that picture is different. So I think that the first part of the plan, you have to have a clear vision of the things you want in your life as you continue to age. And I say that this way because many of us are told, well, we're a certain age, we should have this, this, and this. And we should have this much money, and we should have this. And quite frankly, the answer is individual to each of us. You have to think about what you want in your life and plan according to what you want. But it can't be what your children want for you or your grandchildren want for you. It's your life. And while you are able to make the decisions for yourself and plan accordingly, this is when you should grasp it and begin to clear your vision, sharpen what you want to do, and start to put these pieces in place. And that's why we're having this discussion. So I always ask this question, and it is one of my favorite words is thriving. Thriving, living our optimal life. So you have to consider for you, what will it take for you to keep thriving? Making sure that your heart is healthy, making sure that you're eating properly, that you're moving. I don't want to use the scary exercise word, so I use the word movement. No one's afraid of that. So for each of us, again, it is about what is it going to take for us to continue to thrive. And I want each of you to think as we go through this program, make notes for yourself on each of these points, what it will take for you to keep thriving. I can't answer that for you. So here's I think where it considered and some of the where it begins and some of the questions that you should ask. What is my optimal life? So some of these questions that I've put down form the outline of what you want in the future. And we're going to address many of these points as we continue through tonight's program. So the first question, is my health where it should be? And when I speak about health, it could be physical health. I could refer to emotional health. I could refer to spiritual health. And I could also be referring to mental health. So think in those terms, not in the simple sense of physical health, but in the broader sense of, is your overall health where it should be to live your optimal life? What about your lifestyle? If you are active and you're moving and you're going out there and playing golf or tennis once a week, what will it take for you to be able to continue in that lifestyle? Or maybe you're meeting with friends. And of course, we're not meeting in public as much as we used to, but these are things to be considered toward what your optimal life is. How about this? Am I living in the right home for me? You should be able to move about your home safely in all parts of your home, and you should be able to access things like the bathroom and the kitchen and entering and exiting your home in a safe manner in order to determine if it's right for you. Those are some of the questions that you should ask. And how about this? Your finances. In order for you to continue to thrive, do you have your finances in order? Another thing we'll talk about is our medical wishes. Medical wishes are how we would want to be treated, God forbid, if we ever became sick. Never has that been more relevant than during this period of time where we're faced with COVID-19 and the coronavirus, as we all know. We all should have in place what our medical wishes are, how we would want to be treated if we ever became sick, who would be our advocates, and how we move forward in a healthy way. Part of our optimal life should also consider, what if we each need additional care and support? Who will provide that care and support? Where will it come from and how will it be paid for? And this is important, once you write down your plan and your wishes and your vision of what you want, you make sure that you've shared those wishes with your loved ones and those that are relevant to your future. So I always ask this, what will it take for me to get there? So far, we've each started to picture in our mind that destination. If we want to go on a road trip, we have to have in mind first where we're going to go on our road trip. We can't just start driving aimlessly and get to somewhere where we want to go. We have to have a plan. So what will it take for me to get to that destination? And when should I start to plan? The answer when you should start to plan is immediately. And that's why you're listening to this presentation, and hopefully you should begin soon after this. So the first things that should be considered, these are the big pieces. And because of the length of tonight's presentation, I won't be able to get into the complete depth of each entire issue. But these are issues that each of you should look into for yourselves. You can reach out to me if you'd like. My contact information is available at the end of this presentation. But these are some things that you should begin to ask yourself. The components are the legal issues. What legal things, what documents, what legal aspects should I consider in order for me to live my optimal life and be able to age in place with dignity? What about the financial piece? How much is it going to cost? How much money do I have to set aside for certain things? Medical care, again, this time has pointed out to us how important it is to have medical care in place, the right medical care for us as we continue to age. And remember, we are our own best advocate to provide the best support for ourselves as it relates to our medical care. Individual care, that's considering when you can't completely care for yourself. Who is going to care for you as an individual if you need more help? And what's the living arrangement? So these are the things, the big rocks that we should start to look at. First, the legal issues. When we're considering the legal issues, we are thinking about how we can protect ourselves, our partner, and our family. And that's important. You need to have the proper documents in place that can help you set yourself up for success, both while you're alive, and set your loved ones up for success in the event of your passing. Some of those documents are as follows, and again, I'm not an attorney. This is basic information, so each of you should take the time to contact your attorney and find out what's relevant in your situation. And I want to point out, if you have questions in any of these areas, please speak to an expert in that area. Nancy from the grocery store may not know your situation or legal issues, so you can't always compare your situation to Nancy in the grocery store. It's best to ask a legal expert about legal issues, a medical expert about medical issues, and so on. So the first document that I talk about is called the Healthcare Power of Attorney. It's a legal document that names the person or agent who will speak for you in the event that you cannot speak for yourself or make decisions for yourself regarding your own health. This document is simple to put in place. It's not limited to end-of-life decisions. You can put a healthcare power of attorney in that if you're having an operation, you can have a healthcare power of attorney. So someone is making decisions for you while you're under the knife, so to speak. So this is something where you're outlining and putting a document in place to determine and speak to the point of who will speak for you if you can't represent yourself. When you have your healthcare power of attorney in place, if you start to develop, God forbid, dementia, here we are with Dementia Friendly America, if you start to develop dementia or other types of issues where you can't speak for yourself or represent yourself in a healthy way, this document will allow someone to step in. And I recommend to have a healthcare power of attorney and have a secondary person who is willing to carry out your wishes in the event that something happens to your power of attorney. The second document, which you should always have in place, is called your advance directives or living will. Your advance directives spell out specifically what type of medical treatment and medical support, life-sustaining medical treatment, or whatever it is, you would wish if, God forbid, you were ever incapacitated or it was life-sustaining. Some people, due to religious reasons or personal reasons, don't wish to have their, have themselves cut open if they ever needed some sort of internal, life-sustaining measures. Some people don't want to have a tube down their throat. Some people don't want to be hooked up to life-sustaining, breathing apparatus or things to keep our heart beating steadily. So it's important, while you are of your right mind, that you spell out what your wishes are. And I want to point out in this regard, when you spell out what your wishes are, you actually unburden your family from having to make those decisions for you. You spell it out, you put it on paper, you have it certified, and those are your wishes that are, that are carried out. And that's critical, because we each have earned that right to make those decisions for ourselves. So that's the advance directive or living will. Another document that's truly important in this day and age is the HIPAA authorization, the Health Information and Portability Act, which we each have protected health information, which no medical practitioner is allowed to share unless we each give them the permission to share that information. So if God forbid you have to be at the hospital and you have 4 children, and you want each of those children to talk to your medical practitioners while you're at the hospital, then you should have a HIPAA authorization form for each individual child so that they're authorized to speak to those healthcare providers. It's important, but I advocate that you should have one person who will be your voice. That's your healthcare power of attorney, your primary advocate. They understand your wishes and they're willing to carry them out. You may authorize other people in your family or friends or whomever, your partner, who will be able to talk to the healthcare practitioners, but your healthcare power of attorney should be the one that makes the decisions regarding your care. The 5 wishes form, I mentioned that as it relates to your living will. The 5 wishes form basically addresses these points. Who do I want to make healthcare decisions for me when I cannot make them? What kind of medical treatment will I want or not want? How comfortable do I want to be? How do I want people to treat me? And what do I want my loved ones to know? You can fill out your 5 wishes form in the state of Maryland. They're available in all aging and family services offices throughout the state of Maryland. Our website information is there if you want to use that to complete your 5 wishes. And that's another way of establishing your living will and what your wishes are. There's other legal documents as well that we should know about. And again, not an expert on the legal piece, but I want to address these. A will. A will is a legal document which helps the disposition of your property after your death. So your will doesn't speak to anything while you're alive. It's the disposition of your property after your passing. So if you want to leave your home to someone and your property to someone, and everybody has something that they wish to leave, you can write out your will, and in each county, you can certify it with your register of wills in that county so that there is a document in place which speaks to the disposition of your property after your passing. Another thing that we hear about is what's called a trust. That is a fiduciary arrangement that allows a third party, a trustee, whom you assign, to hold assets on the behalf of a beneficiary or beneficiaries. So if you have, let's say, a large chunk of money, but you don't want your grandchildren to get it until they're 18, you might put that into a trust. But again, each person should consult with their own legal professional to see what relates in your situation. I just bring these to bear to just begin to highlight some of the information which you should need moving forward. I spoke earlier about financial issues. The big question to ask yourself is, how much money will I need to allow me to live the way that I want to live? So what are the things that you want to consider? If you're active in your lifestyle and you like to travel and you like to play games and you like to have a nice car and you like to have a nice residence, that takes a certain amount of money. But you should also consider, what if I need health care? What if I need certain types of medical treatments and that sort of thing? How much money will I need for that? Should I set that aside? How about my residence? If I can't live in my home safely the way it is, am I able to have my home modified to allow me to continue to live safely in my home with modification? How about this? How much money will I need for final arrangements? For some, it's an elaborate funeral and a burial. For some, it's a memorial service and cremation, whatever it is. Each person has their own individual wishes. But if you set that money aside ahead of time, you are planning the way you want it to be conveyed, and you're unburdening your family as it relates to making these arrangements and having them in place. And frequently, if you purchase your funeral in advance, you can take advantage of today's pricing versus what it might cost 10 years from now. So that's something to consider. And again, each of you should look into your own situation. And the last thing I want to speak of regarding the money, the financial piece, is the money to convey forward. I spoke earlier a moment ago about a trust or conveying money to your loved ones in a will. How much money do you want to convey forward? Maybe your loved ones want you to spend all your money living your life. That's what I've said to my mother, but everybody is different. So each person should consider how much they want, how much money, property, whatever it is, they want to convey forward. So these are important issues. And there's no way we could convey all of these in great detail in a 30-minute conversation. But these are the things that each of you should begin to think about and plan for if you haven't already. How about this? My medical care. I've been in the home care field now for 10 years. I've been in healthcare for more than 20 years. And there was a myth that everybody thinks that when I get to 65 years old, I'm going to be completely covered. Everything's going to be paid for. And I describe that as a myth because that's what it is. We each have to plan for our own medical care. How will it be paid for? And what sort of extra support we set up for ourselves. So many of us will qualify for Medicare when we hit a certain age. And Medicare pays for most of your medical issues, things that are medically necessary. And every Medicare plan is different. So again, speak to a Medicare specialist, but you have to consider your insurances moving forward to make sure that you're receiving the proper medical care in order to allow you to live your optimal life. Supplemental health insurance. So many people qualify through an additional insurer, Aetna, Blue Cross and Blue Shield, or one of those other companies to provide a supplemental health insurance. Maybe we got it through our employer or something like that. So we should be aware of what our coverages are as we continue to age. And each of you should look into that and know where you stand accordingly. Medicaid or medical assistance. If we're at the poverty level, or if we meet certain other criteria, we might qualify for medical assistance. So what does medical assistance cover? How do we qualify for it? Are we allowed to have assets? These are the things that are important. You can't just wander into aging in place and think that everything is going to fall into place. Additionally, there's the VA, the Veterans Administration, and there could be a couple of veterans benefits which help you age in place properly. But if you are a veteran or a family member of a veteran, you should look into each of those benefits and find out where they are, find out what it takes to qualify for them, and how long it takes. Again, it's about planning for you. Many people also look into long-term care insurance. I highly recommend that because long-term care insurance could pay for things like non-medical home care, if you ever need that to stay safe and continue to thrive in your home. Or it could pay for assisted living care. Every situation is different, and each of you should look into the best fit for you. How about your living arrangement? Am I in the right size home? Maybe we don't need 5,000 square feet if we're living alone. The questions you should ask: can I move about safely in my own home? Are there any steps that I can't negotiate or other impediments in my home that are impediments to my own safety? Things like stacks and stacks of boxes that you've never unpacked, or piles of magazines that we're collecting. Consider this: are all of the rooms that you have in your home safe for you to use? Are the kitchen and bathroom appropriate for your use? If you're shorter, if you can't reach as much, you can have someone come in and modify your kitchen and your bathroom so that the things that you need to access on a daily basis, you can access them safely and allow you to continue to thrive in your home. Are outside conditions appropriate for your safety? Your lighting in your neighborhood, your lighting around your home, your sidewalks, your yard, are those types of things safe? These are all things to be considered as it relates to the living arrangement and what it means for you to live your optimal life. The neighborhood. When you moved into the neighborhood 30 or 40 years ago, it was a different neighborhood. Is the neighborhood now continuously safe for you? And these are the things that you should consider as it relates to that. Home care. You might want to receive care in the home instead of going into a long-term health setting, a long-term care setting, skilled nursing center, long-term care, or assisted living or continuing care community. You may want to receive home care resources in the community. So typically they're private pay, but you could have Medicaid waiver, which pays for it, or certain veterans benefits. Home care can be provided by a licensed home care agency that can help you with companion chore services. They can help you with your hygiene and personal care. Make sure that in choosing an agency that you choose one that employs the caregivers and vets them, because your safety and peace of mind is critical moving forward. You want to make sure that they're vetted and trained and that they're bonded and insured when they come into your home. So here's my question. I've covered a lot of information in 30 minutes. When will you make a plan? My name is Mark Asch. Again, I'm with Right at Home. I am happy to be representing Dementia Friendly America of Prince George's County, Maryland, the northern sector. And I'll throw this back to Mitch, and then we'll open it up for questions after Mitchell makes some announcements.
Thank you so much, Mark, for that excellent presentation. Mark, I'll have you just advance the slides just so we can get through some dementia-friendly America-related services that we'd like to highlight during this webinar. So the first being our virtual support groups. We have support groups for caregivers and for social distancing. We've adapted these during COVID to make them as accessible and effective for you all. So if you're interested in those, definitely reach out to us. In addition, we have a monthly email newsletter that goes out at the beginning of each month covering free services that we have available, such as the webinar that you've attended here. as well as other resources and just dementia-friendly updates. And then finally, our Dementia Friendly America YouTube channel for Prince George's County Northern Sector has just a plethora of educational videos such as this one. This video will actually be uploaded at some point in the future. So go check that out. And if you are interested in any of those services, you can reach out to Sharon. Her contact information was on the prior slide. Some additional services related to aging
Sorry, I
are,
went back.
no worries, are listed on the screen here. So the number at the top is Prince George's County, Maryland's Area Agency on Aging, excuse me. And then in addition, we have some community programs, some aging related information from NIH, um, not just NIH, but just the National Institute on Aging within NIH as well. And then the CDC has some information on aging if you're interested to check out as well.